coronavirus has so far killed at least 67,000 people in the United States, and at least 1 million cases have been reported. The country's earliest COVID-19 fatality was announced on February 29th, but it was first on April 22nd that officials in California announced that tissue from 2 people who had died in early and mid-February had tested positive, which means that the virus may have spread in the US much earlier than first thought. Through March and April, some states and cities has changed the criteria for reporting deaths, and some jurisdictions continue to fine-tune the counting and reporting procedure. This means that the numbers may fluctuate, and therefore it can be difficult to compare the numbers and analyze statistics. For instance, New York has subsequently added almost 4,000 deaths in mid-April, which is probably why it seems that nearly 6 times as many died on April 14th compared to other days in April, but that's obviously not the case.
The health officials agree that the number of reported cases is much lower than the actual number of people who have the disease. They did it because the testing was slow in the beginning. In reporting by all local jurisdictions was different, and this explained the low number of deaths. There are few places with large outbreaks which are called hotspots. New York is one of them, and since March 13 there were 24,000 deaths out of the 316,000 cases reported. It was the day the government ordered Como announced the death of an 82-year-old woman. New York is a populous state, but they also lead the country in death per 100,000 residents, and the neighboring states are not far behind. Louisiana has also been hit hard, as they have a month-long carnival celebration that drew more than 1 million people to the city in February.
So this article, the next section of this article, goes into the fact that it's not just the area around New York that is having a hard time handling coronavirus. It is also the state of Washington, or actually Seattle, where the outbreak started. A large number of older people have died here, which of course matches the worldwide trend where people with pre-existing respiratory problems and people above 50 are much more likely to die from the virus. It also mentions Detroit, where you have a large number of infections per capita, as it says, because people in with higher levels of poverty, people living in areas of higher poverty, have more diabetes, heart disease, and obesity, and thus they are more likely to risk dying from it as well. It also mentions the fact that it's not just an urban issue. While the absolute numbers in rural areas are relatively low, when you scale for population, the deaths and cases per capita are sometimes very high in rural areas. It also mentions that people in rural areas are more likely to die from influenza, and as such, you might think that they are also more likely to die from coronavirus. Here you can see the amount of deaths per capita, mainly in counties in New York and Georgia. If you look at cases, there are also some other areas coming in, including areas like Nebraska and Tennessee that don't have a high population compared to New York. And if you look at raw numbers, obviously in that case it's going to be concentrated towards the highest populated counties in the country. You have Chicago, Los Angeles, Detroit, and then you have a bunch of areas in New York.
Yes, I want to talk about the last part of the article. The first statistics I want to show is this one: 10 counties with highest rate of death. We can see that in the state Georgia, there are a lot of counties that are very badly hit by the virus, and as well in New York State, there's also a lot of counties that are bad areas. And the article talks a little bit about why. In Georgia, it is actually the Dougherty County that is very badly hit. Although it has fewer than 1,000 people actually living there, but more than 1,000 cases and dozens of people has died here. It also talks about California. The article says that the disease infiltrated San Francisco and Los Angeles very early, but they are not on the top of this list because of the governor's heroic action. Because he issued a statewide stay-at-home order on the 19th of March, so that was very early. And afterwards, many governors has actually followed his example, and data actually shows that this early social distance orders are actually working very well against pandemics. Then I want to talk about this statistics, tests reported per 100,000 residents. And here we can see that New York and California are the states that are worst hit. And not so long down the list, here it is Georgia. So these states are some of the states that are worst infected. And this makes very much sense because up in this one, we saw that both Georgia and New York had some of the counties that were highest, that had the highest rate of deaths. On the 16th of April, the virus was decreasing some places in the US, or in other places it was actually just arriving. But anyway, the Trump administration released a framework for a reopening. And this is actually very different from Denmark. We are waiting much longer with the reopening because for health-related reasons, it's better to keep being locked down for a longer time. But in the United States, you don't have as many welfare benefits as we Danes have. So very many Americans will lose benefits like their health insurance, if they can't keep working. So obviously, the president in the United States, Trump, has to reopen a lot faster. Yeah. But all of these statistics that I have talked about and all of the political decisions are very hard to make in the US because they don't have a national coordinated testing system. So all the states have varied ways to test, and they have varied ways to arrange a testing system. And as a result for that, are consequences like delayed statistics and a much higher percentage of the population being tested in one state compared to another. And this is a very big problem when you're facing a pandemic like Corona, because you don't have like basic data to back up your decisions.